Thank you. So lovely to be here. Thank you, Julian, for introducing us. And I'm going first, and then I'll hand over to my colleague, David. So first of all, colleagues, congratulations on joining the Public Health Training Programme. It's a very, very popular specialty and really, really competitive. So in actual fact, we had over 1,000 applications for just 99 places. We always are lobbying our agencies to give us some more slots, because we know that there are a lot of people that would like to train in public health, many more than we have places for. But nevertheless, you're the people that have been successful. So many, many, many congratulations. I think COVID has put public health in the spotlight in a way that only pandemics do. There's been a surge in interest. It certainly hasn't put people off. I've been saying that to the chief medical officers, that actually they were very concerned that the pandemic might have put people off, but I can say it's probably increased the interest in public health. And I think in a way it's no real surprise to see that people really value public health. And I suppose if you really want to make a big, big difference to the health outcomes of the population, then public health is a specialty for you. But obviously, you're at the start of your training programme. I'm very privileged to be a head of school in the Southwest, so I'm spending a lot of time with the people that have just started our programme in the Southwest, and a big hello to them today if they're on this call. It is a fantastic specialty, but it's hard work. I think sometimes when I meet with the other presidents in the other medical specialties, they seem to have an easier deal, because in public health, it's a very, very broad curriculum and a very, very broad skill base. And we talk about the science and the art of public health. So a lot of what you're learning is not just simply what to do and how to do it. It's actually developing yourself as leaders and system leaders and being at the forefront of all those changes within organisations, not just NHS organisations, but actually anyone who can help influence public health. So we know that it'll be very hard work for you. And as a faculty, we're very much here with the training programmes to support you. And then I also just wanted to let you know, and I'm sure David might say a little bit more about this, we're very fortunate to have David as our academic supervisor, and colleagues like David and myself, we all work voluntary for the faculty. And we have been working on a slightly refreshed curriculum. So David might touch on that in his introduction. And the faculty registration is a very, very important part of your membership of the organisation, and having the access to all those standards, this very, very high standard programme in public health. And we will be sharing more with you. But actually this morning, I was on a call with the Association of European Public Health Schools, and I'm delighted to say they gave a special award for the Faculty of Public Health, the UK Faculty of Public Health training programme, as they considered it to be not just the best in Europe, but the best in the world. And we do share that curriculum, particularly with low-income countries, so that we can help develop public health, not just in the UK, but across the world. I'd also like to pay tribute to Julian and the team. I noticed we've got Marilyn and a few others on the call today, Julian, but obviously we couldn't run the training, the bits of the training programme that we are responsible for, the exams, the curriculum, without you and the team. And you do an amazing job. It's a small team, but I'm sure colleagues who are joining us today, our new registrar group, you'll find them very, very supportive and very, very helpful. And then last but not least, as I say, I would like to thank all the officers and people working in the faculty. I'd also like to thank Alex, who chairs our specialty registrar group. all of the extra tasks that we do are just done on a voluntary basis. And I know that I couldn't manage without the support of David and my other officer colleagues. And I do hope in the future, as new registrars in public health, you will think about joining committees and you will think about influencing the faculty into the future. I said at the start of my presidency that I wouldn't go to any national meetings and UK-wide meetings without mentioning our specialty registrar group. And I did commend you this morning when I was accepting the award from ASFA, because we wouldn't be getting an award unless we had outstanding registrars in public health. And the registrars in public health are at the heart of everything we do. So without all this interconnectivity, we would not be as a successful programme, as successful as we are today. So basically, we need you as much as you need us. And I look forward to working with you and wish you all the success in your future public health career. Thank you very much indeed. I'll pass over to David.
Thanks, Maggie. So just to introduce myself, I'm David Chappel. I'm the academic registrar, which means I oversee the processes around specialty training. So I chair the education committee, in which, as you'll discover later, there's an important way in which trainees input into the processes we have through the specialty registrar committee. So firstly, just to extend congratulations to everyone on getting through. As Maggie said, it's been really incredibly competitive this year, so you've done extremely well. The second thing is to say the faculty is the standard setting body. So the main things that we do around training are things like the curriculum and exams. I'll come back to those in a second. But obviously your training is actually run locally by the various education statutory education boards in the four nations. So this is also, the faculty is also your organisation. You know, you belong to it, you have a stake in it, and you'll have the opportunity to influence it. And so, just to reiterate Maggie's point, you know, do get involved if you can, because there's plenty of opportunities to try and influence things if you don't think they're right. I think you'll find the next few years on training, as Maggie said, will be hard work, but actually great fun. I think you'll find it incredibly enjoyable and stimulating. It is very much an apprenticeship style thing that you're learning on the job. And so in a way, it's slightly sad that what we do in the faculty are things that might sort of be less fun, like doing exams or getting all the curriculum together. But I think you'll understand why that's important. So this afternoon, we'll have a bit more information on the exams. Just on the curriculum, as Maggie said, we've done what's called a light touch review of the curriculum this year. It will be so slightly amended next year, the curriculum, 2022 curriculum. It will not really impact too much on what you're doing, so don't worry too much about that. If you extend your training long enough, you might be still around for a further curriculum review in 5 or 6 years' time. But as I say, I wouldn't worry about that, because we work very closely with the trainees to make sure transitions are smooth. And we've got tools and things to help you through. Gareth's going to talk a bit later about the e-portfolio. So as I say, the faculty is your organisation. You've got input into the processes where you can through the Specialty Registrar Committee, and we're just going to take you through some of the key things that the faculty is responsible for this afternoon. And you'll meet various members of the team. Maggie's already introduced one or two, like Julian, but actually I think as you go through training, you'll get familiar with names, even if you don't actually physically meet them for a while. But we're always very keen to hear and help people. So, you know, don't hesitate to get in touch if there's things that you want us to sort. And hopefully there'll be plenty of information this afternoon. But I know from personal experience, whenever you go to induction, it's kind of as much just flagging who to ask and the things that you'll need to ask about, rather than necessarily remembering everything you're told this afternoon. So don't panic about that. And hopefully most of it's on the website as well as if you need it. So I'll tie up there and then let Julian get back to running the afternoon. So hope you find it stimulating.